For more than 2 decades, the research has pointed one way. People who move more tend to develop less dementia. That association is consistent and real. The harder question, and the one most coverage skips, is whether the exercise is what's causing it. Physical activity is one of 5 pillars of brain health, and it's the one people feel most confident about. It's also the one where the evidence is least settled. The first major finding came from Canada in 2001. Researchers followed over 9,000 older adults, and among those who started out cognitively healthy, the most active had about half the odds of developing Alzheimer's over the following 5 years. A few years later, a study in Hawaii made it concrete by measuring how far older men walked each day. The ones who walked the least, under a quarter mile, had close to twice the dementia risk of those who walked more than 2 miles. The same year, a large study in women found the same pattern. Different groups, different countries, all pointing one direction. That's how the idea took off, and for good reason. These were big studies, well designed, and they tracked people's activity years before anyone got sick. The takeaway that spread to clinics and the news was simple: move more, stay sharp. But the people who move the most differ in other ways too. They tend to be leaner, have less diabetes, eat better, and get more medical care. Any one of those could be the real protector, and the exercise might just be riding along. So 2 readings fit the same data equally well. Either exercise guards the brain directly, or it's mostly a marker of a healthier life, with early disease quietly making people move less. In 2004, nothing could tell the two apart. Settling that needed a different kind of study, one that puts people on an exercise program and then tracks what happens in the brain. That study came next, and it produced one of the most cited results in the field. That's part 2.